Portrait Masks and Identity After War, Anna Coleman Lads, and What We Learn from The Facemaker. World War I caused widespread facial injuries on a scale people had never known, making it also historically significant. Because artillery, shrapnel, and trench warfare commonly hit the head and face, many soldiers survived with severe facial deformities. And while surgeons such as Harold Gillies focused on reconstruction, another answer came from art. An American sculptor named Anna Coleman Ladd founded the American Red Cross Studio for Portrait Masks in Paris and produced thin metal masks for injured soldiers. These masks were cut to the individual's face, color-painted to match skin tone, and often even bore subtler designs such as mustaches. Their purpose was not to restore function, but serve to restore appearance in public life and confidence. And this is important because facial injury impacted people far more than mere body fatality. Facing a face is intimately linked with identity, communication, and social acceptance. Historical accounts tell us what many wounded men were afraid of. They couldn't bear to be seen in public, struggled with shame and isolation. Ladd's masks were a way for some of these men to regain their dignity as people. By a historical account, the soldiers who were given the masks felt more capable of returning home and rekindling relationships there, indicating that masks represented emotional and social healing as well as physical concealment. This ties directly to current nursing practice. Nowadays, nurses treat patients with facial trauma, burns, and cancer-related disfigurement, and with reconstructive needs. Signals such as distress, anxiety, depression, or changes in body image have been documented, and findings of facial disfigurement have been found to provide a significant psychological dimension to the clinical setting. The effects of maxillofacial trauma go beyond physical injury to include both the long-term and the psychosocial manifestations. Nurses, therefore, have a great responsibility to promote not only wound healing and physical healing, however, and also self-esteem, coping, and readmission to normal life. This is why trauma-informed nursing matters. Trauma-informed care calls on healthcare professionals to create safety, trust, respect, and a non-judgmental care approach for those who have experienced trauma. For patients with visible differences, this involves using respectful communication, maintaining dignity, maintaining awareness of stigma, and understanding that changed appearance can affect a person as a whole person. The connection to The Facemaker is that it's much more than simply a book about medical innovation. It is also a book about what happens to identity after catastrophic injury. Anna Coleman Ladd's masks are tailor-made for that theme, but they demonstrate that post-war, healing was as much about healing tissue or healing wound as closing them. It was also a question of whether a person could recognize themselves again and whether society would allow it. That still matters in nursing today, when many times nurses assist patients not only to survive, but also to keep dignity, adapt, and human connection. So, in a broad sense, portrait masks are a niche but very particular topic of this period because they show that recovery from facial injury was not only physical. It also involved psychological, social, and identity deeply intertwined.